Second time in one day. Don't you feel blessed? Anyways, I wanted to come on here and talk about the dentist appointment I had today. I ended up seeing a new dentist because I got dental insurance for the first time in forever. So I ended up seeing a different guy, and I thought some points that were discussed were probably stuff that you guys could come across at some point, and if not, maybe you just wanted the information. So first and foremost, do you get medicated with antibiotics before you get your teeth cleaned as a heart patient? That has been a real toss-up with doctors that I've spoken to. My primary care doctor and my old dentist say no, not unless you had valve-sparing surgery, which I have not. This dentist, especially because I had sepsis, he said absolutely 100% he wouldn't go ahead and do the cleaning without me having, I believe it was 3 doses the day before, doses the day of, and 16 total. So a good pre-medication. Therefore, I did not get my teeth cleaned today, and I am fully fine with that. He did examine me, but I am completely fine with him being proactive in that, because what happens is, when they're scaling your teeth and cleaning all of this bacteria off of your teeth, if you bleed, which I don't know anybody that doesn't, it's opening up your bloodstream to bacteria. If that bacteria gets in your bloodstream, that's an infection. If the bloodstream goes to your heart, that leads to endocarditis, which is an infection in or around the heart, and it can be deadly. They actually tested me for that when I had sepsis, and the test that they gave me was called a TEE, which stands for transesophageal echocardiogram. And apparently, since you're going, and they go in like they do an endoscopy, so they go down your throat. So apparently, where it's right there by your heart, it's more accurate than like topical when you get just your regular yearly echogram. So, to me, I would much rather than be proactive and not have that fear or worry in the back of my mind about, okay, is this going to be something? Do I need to watch for these signs? But, like I said, not everybody agrees. If you are a heart patient, that is up to you whether you want to be as avid as I am. I mean, you guys know that I'm on the ball with that kind of thing, so I want the very best first, you know what I mean? So I personally want antibiotics. Whether you do or not, that's up to you, but I want to make you aware of it in case you've never even heard of it. Maybe your dentist doesn't even know you're a heart patient, so they wouldn't even know to bring it up to you. So you need to be aware of that, and you need to be your own advocate, as I preach all the time. Moving on, we talked about my TMJ, which isn't too awful right now. It hurts like a mother, but it was so swollen last night and this morning, and it swells like all the way up through here. So it literally just feels like somebody went and punched me in the side of my face. And the swelling, it looks like somebody punched me in the side of my face, really. So I've been calling around to oral surgeons, and all of the oral surgeons in this area won't bill insurance. Not just my insurance, but insurance. So I was just having my chiropractor manipulate my jaw, which does help when it's locked up. But I was really pleased that he was willing to talk to me about it. Everybody does ask, oh, well, do you have a bite guard? And I do. I didn't think prior enough to bring it in here and show you. But it's one of the ones, if you know anything about bite guards, it's not pliable. So what you do, it was molded to my teeth by an oral surgeon years ago. So you run it under really hot water until it becomes pliable enough to fit over your teeth. So after it doesn't cool down all the way because your mouth is a warm environment, but it's still very hard. So when you're grinding your teeth in this very hard plastic, it might help to not grind your teeth down, but if you have TMJ, it hurts. It hurts a lot. So that's not been something that I've been able to do because it hurts. It hurts to even try to get it in, much less sleep with it all night. So his viewpoint was that he doesn't like those kind for a lot of different reasons, most of which I just named. So the one that he recommended is the kind that you can get at like CVS and stuff, but those aren't molded to you. So for me, he gave me that option. I would just rather have one molded to me and try to knock out as much confusion as possible. So we're getting that pre-authorized so that I can try that. They're not like a rubber band pliable, but it is much better than the one that I have. You can move it back and forth. And he demonstrated on his little skeleton jaw thing how when you bite on it, it basically forces these muscles to open and to relax all night long. So that might really help me. I'm really hoping it does. Because, it's been so bad lately that I haven't even wanted to eat real food because it just hurts. And chewing is a lot of work. So I've been doing soup and applesauce and things like that. Potatoes. So that with TMJ, he did say that the chiropractor was okay, which that wasn't going to make me stop going to my chiropractor, let's be honest. But he mentioned going to a massage therapist for it as well, and not just any massage therapist, because they have to be trained in that so that they don't do more damage, because that is your jaw. It is very important for everyday life, forever. So, he wanted me to talk to one of those. She was busy, so I didn't get to do that. But realistically, if insurance doesn't pay for that, can I afford that? No, they're expensive, and I'm sure it's more than one treatment. So we'll see, but I'm not holding my breath over here. What else do we talk about? My bone structure is good. Hallelujah, right? Something good. And I always make sure that I tell them, first and foremost, I've had gum surgeries. Well, I guess not very many people that he's seen has had gum surgeries. So he kept thinking that I was talking about bone grafts. And I'm not. My bones, I guess, are great. So I had tissue grafts. So the first one, they took the tissue from the roof of my mouth and sewed it here, because my gums, it's called gum recession. Those still look pretty good. I know you just wanted to see my teeth. But basically, if you don't fix it, you can lose your teeth. Then you can lose your bones. Not lose them, but it recedes and your bone starts to deteriorate. And then if you keep letting it go without fixing it, your face can be fully deformed, obviously, and you lose your teeth. So we're not talking it doesn't look very good. No, it's a lot more than that. I know it doesn't come across quickly to most people, but it is a lot more than that. So I've had it in 5 areas. The one I just told you about here, and I had it here, 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 and here. Okay, I do need it probably pretty soon here, because it's starting to recede there. So I told him, I said, I have Marfan syndrome, and For one, he didn't know what Marfan syndrome was, not like at all. I don't think he's ever even heard of it. So I explained it to him, and even after just hearing about it, he said, "Oh no, that's not why your gums recede." And I'm like, I mean, yeah. Yeah, it is. So he went on to talk about, oh, well, you probably brush wrong. I don't. They tell you don't brush like this. Don't brush hard. Well, I don't. I use the very softest toothbrush. On the top, I pull down. On the bottom, I pull up. Exactly like they tell you to do. So that's not it. You grind your teeth. Yes, I do, but I mean, I've worn my bite guard up until probably a few months ago when my TMJ started flaring really badly. So that's not it. I'm not saying that those don't affect it at all. I am, however, saying that I am much more I don't know the word I'm looking for. I'm much more open to having this happen than the normal patient because our tissues suck, right? So after I told him that there's actually a pretty common thread in the Marfan community with this, he still didn't attribute it mostly to that, but I mean, I guess he gave up arguing with me because I was persistent. Imagine that. So, you guys need to be aware of that. I don't know that your dentist would just tell you that you're having minor recession if it's not really bad. I mean, let's be honest, most doctors in general don't tell you something unless it's really bad. And then at that point, you've done a lot of damage. So same thing with this. You need to be aware of it. You need to be using soft toothbrushes. You need to be brushing correctly. If you grind your teeth, get a bite guard. All of that does play into it. But if you have a connective tissue disorder, we're more likely to have this happen. So you need to be aware of this. If your doctor tells you, or your dentist or your oral surgeon tells you that it's not Marfan syndrome, that's up to you whether you want to argue with them or not. But don't let them convince you that it isn't. I'm not the expert here. I'm not a professional, but no one will ever convince me that it isn't related. I have a really hard time believing that anything tissue-wise is not related because, I mean, how do you rule that out, right? And your gums are nothing but tissue. I'll step off my soapbox. I'll leave that to you whether you want to get on a soapbox excuse me, with your dentist or not. Totally up to you. I did my job. I told you about it. I warned you. What you do with it is up to you. So I didn't get my teeth cleaned today, thank God, really, because my jaw was awful this morning. If I would have had to hold it open that long, it would have been really bad. I went to the chiropractor directly after that because he's located in the same business park, and he manipulated the crap out of it, and it popped a lot, and it didn't feel good at the time, but the swelling is down. I do still have to ice, and I really didn't eat dinner, but it's better. So I will go back in August, and I will go back pre-medicated. He ordered my antibiotics. It's going to be clindamycin, which is a pretty strong antibiotic. So hopefully I'll be golden. So I will take that prior to, the day of, and after. Again, I'm thinking that's all that we discussed. Well, I had sepsis. I told you that. So he was very adamant about that. And he asked me also if I had any implants, which I do. I have artificial lenses, implants. And in my hip, there are artificial anchors anchoring my labrum to my hip. So that, coupled with being a heart patient, coupled with sepsis, I'm super glad that he gave me antibiotics and didn't proceed and cause damage. So that's all I can think right now that he said. If there's anything else life-changing, I'll put it in the comments in case that's something that I feel you need to know. But my three biggest, I guess, takeaways from this live. You guys know that I'm all about sharing if my experience can help you. I've already been through it, right? I've already fought with the doctors. I've already had surgeries. So if my experience and my pain can help you, why would I not share that? That's exactly why I share all of my struggles. So like I said, the three biggest takeaways. If you're a heart patient, at the very least, ask about antibiotics for a prophylactic before you get your teeth cleaned. Now, granted, you're supposed to do that every 6 months. Am I telling you to take antibiotics every 6 months? I would, but that's up to you. TMJ, if you also suffer from TMJ, your bite guard could have a lot to do with it. And if you have one of the hard ones like I do, it could be worth either one, going to your doctor and trying to get a pliable one, or two, the easier route would be going to CVS or wherever and getting one over the counter and see if it helps you at all. 3, gum recession. I know that's not a popular topic, but at the very least, have that in the back of your mind, because you don't want to lose your teeth. Let's just say something else happens and you have to get dentures, a whole mouth of dentures, okay? That's not the most horrible thing in the world. Losing your teeth isn't the end of the world. But when it starts to erode your bone and then your face starts to become deformed, that's not something simple, guys. Like, that would require a lot of work to get that back to where it needs to be to function correctly. So don't let that happen. If you're doing your own exams, which I'm assuming most of us probably do, keep an eye on it. If you notice that one of your gums is going off the chart and you're just seeing way more tooth than you used to, bring it up. All that can happen is your doctor can be annoyed. And if you have any type of connective tissue disorder, I guarantee at least one doctor has probably been annoyed at some point with our care. So, big deal, right? So, gum recession, TMJ, prophylactic antibiotic for a heart patient. I am hoping that you guys learned something from this live. As always, that is my intention.